All right, welcome back, everybody. Glad to be joined this Tuesday for episode 48 of The Brick Wall with Dov Hirsch. Thank you so much. Dov is the general manager of Immersive Health Group, which is a subsidiary of the Glimpse Group. And I forgot to put up my brick wall, so I'm going to do that as you introduce yourself. Tell us about about Immersive Health Group.
Yeah, absolutely, Warren. It's really good to be here. So I've been with the Glimpse Group and the Immersive Health Group for about 18 months now. So I think I'm officially legit as of that 18-month mark. I think the more interesting piece is I've been doing work in the immersive technology space, right? So for about 18 months, because before that I knew absolutely nothing about it. In fact, I kind of thought it was a bit of a joke, like not real. And so my background is really old school, boring, antiquated healthcare. That's what I know like the back of my hand. And so when I connected with this company in New York, it was by complete coincidence and complete accident, effectively, as to how this all came together. But it's been an incredible wild ride, and I would say over the past year, 18 months, and more so over the past 6 months, it's just been like a rocket ship.
And you joined the Glimpse Group and Immersive, right before the pandemic, or just before the pandemic started. What's that ride been like to a new opportunity, and then you're in the healthcare space. You have this unprecedented event going on.
Yeah, I'll tell you how this all happened and how things have only proven, I think, to be I'm in the right place at the right time. When I first met the Glimpse Group, I was really dismissive. They were interested in doing, VR and AR technology in healthcare, and had some ideas as to what that meant. But I was dismissive at first, and then I spoke to a bunch of health systems I had already been doing business with in another capacity, and they basically, the short of it is, they told me how wrong I was. I didn't realize what the opportunity was, and essentially they told me, we're already starting to evaluate things here. We're already starting to run pilots. We're already starting to do large research studies into the efficacy and use of virtual reality, augmented reality for a variety of applications. So I kind of went back to Liron and DJ with my hat in hand and said, okay, there's something here. And so I think there's a real opportunity to do something together. So all that said, I think it was largely about timing. Timing has always been, timing and luck, the two most important variables for my success in my career. And so timing seemed really, really right, even 18 to 24 months ago. Come COVID, and then, the past 3 to 6 months, things have only accelerated, right? So things that people have been talking about for 10 years. So for instance, telehealth, right? Some of the most successful telehealth companies out there have been climbing the steep hill just inch by inch over the last 10 years, just waiting for regulations to change, for reimbursement to change. And then basically on a relative overnight, things just happen. So I think I'm in the right place at the right time on a few different levels. So that's kind of market conditions. I think the other side is, well, how do you deliver impact, right? Because at the end of the day, you really want to make a difference in the market. You want to make a difference for your customers, for your end users. And we're seeing things explode in terms of interest, obviously, for remote learning solutions, right? Anything that can enable people to much more safely engage with each other, but do so in a meaningful way, I think is going to have a huge impact. And virtual reality and augmented reality are essentially the next generation of that.
So what kind of solutions can you describe some of Immersive Health Group's solutions that may have been in the works, but possibly fast track now due to the virus?
Yeah, I would say anything education related, right? So you and I are communicating right now via Zoom and Facebook Live, and it's a two-dimensional experience. And I think we've certainly started to see what the impact is of people using web conferencing tools all day, every day. The short of it is these tools are really great for communication, but they're not educational in nature, right? Education occurs in a very different facet. So education technology, ed tech, is really exploding. And that's where things have really taken off for us. Now, we were focused there before the pandemic hit, so we were very well positioned. But now when it comes to, for instance, a lot of what we do is heavily focused on simulation training using virtual reality. So if you're a health system, then now all of a sudden you can actually best prepare your workforce. They don't even have to be in the same room together, which checks a lot of boxes. And you could do so without sacrificing the quality of that education, right? So simulation has been well documented in terms of it being highly efficacious in terms of leveraging our natural senses and our best way of learning. So that's one side of it. The other side is educational institutions, right? Medical schools, nursing programs, allied health programs. They're all looking for solutions outside of the web conferencing solutions of the world, where their learners can continue to acquire skill sets and knowledge that can then be applied in the market. And so there's really almost nothing else out there that's as effective as what we do.
And then, of the different areas of focus that you have on your website, can you describe them a little bit more in detail, as far as, not just education, but as, the other services, because, I think that in addition to, the 2D or other, technologies, apps being pushed forward, I'm sure that, you guys are developing, and there'll be, augmented and virtual reality, will we see visits in, augmented and virtual reality, and will it be, taken from training into other things?
Yeah, I think the answer is we'll see, right? We have an absolute proof point that cannot be disputed in terms of education. I think that there's a big distinction here. So yes, we've been doing telehealth, right? Using VR. We've been doing pain management solutions using VR. So we've been exploring the different avenues and applications where there's a large body of peer-reviewed research that indicates this has significant outcomes. And it has not just clinically, but it has an outcome on the financial side of healthcare as well, amongst other things. So you take a look at that, and that's really, really valuable. I think it's too early to know what this is going to look like on the telehealth side. If for no other reason, everyone already has one of these, right? Not everyone has a VR headset. So knowing whether or not you're going to be able to reach that critical mass for telehealth it's going to be a time will tell situation. On the reason I focus on the education side is people are accustomed to investing in either technology, resources, dare I say books, right? Things specifically for that application. And so this isn't such a foreign idea that you could actually invest in technology that will dramatically enable your ability to perform on the job.
Cool. So since I bumbled that question into like 6 different questions in one, why don't you take us through all of the offerings of Immersive Health Group?
Yeah, so education is obviously one. Telehealth is another. So telehealth tends to focus almost exclusively on the behavioral health side of things. And then the third would be pain management for distraction therapy, which is often what it's referred to. And
that's also used in like palliative care and other things like that as well. I've read a bunch. Yeah.
Yeah. So it could be acute or chronic. So that's healthcare speak for, I take my child to the pediatrician, and they're, the moment that they find out they have to get their annual vaccination, it's like, World War III. So using it for that episodic need where it's 5 seconds, they don't even know what happened. That's sort of that distraction therapy piece. And then there's the chronic side where people are living with chronic pain on a regular basis. And so using that as sense of immersion to really teleport them somewhere else virtually and really distract their mind from the pain they may be sensing otherwise.
Yeah, that's an impressive, technique. And I've been reading a ton about, how the distraction technique works. And it's fascinating and makes a lot of sense. Seen it with senior care as well. So like as far as your predictions, like what do you see AR VR? How do you see it in the next 5 years, 10 years, jumping into the healthcare industry and seeking more buy-in?
Yeah, I think we're going to see it. So I often say healthcare is really good at it really serves a really good test for technology, right? So typically speaking, the fancier, the shinier the technology, the more poorly it does in healthcare, because healthcare doesn't really tolerate things that don't add value and add value very, very quickly. So, and it's for that reason that one of the reasons I love this industry so much is that it's really got to prove outcomes on a utility base. It's got to prove clinical outcomes. It's got to make your life better on an order of magnitude. Otherwise, it's no better than a pencil and paper. So that's the criteria I think that we need to think about, because at the end of the day, there's massive trends going on in healthcare that we need to recognize, right? So costs completely out of control, right? We spend more in this country on healthcare with poorer results. So if this isn't part of the value driver, then it's not gonna be adopted and embedded and really mature within healthcare. So so that's kind of the criteria I think we need to be thinking about. I think that over the next 5 years, we're going to see an explosion, and that explosion is going to, in a good way. It's really going to focus on two areas. It's going to be the marriage from a technology standpoint of XR technologies, which is often shorthand for like, VR and AR, and then AI, machine learning, right? Essentially where we're headed here is we need to use this technology in a way that makes our lives easier, right? So if it doesn't do that, it's not worth it, no matter how fun it is. And VR is fun, but it has to absolutely accomplish that. So again, going back to education, that's really proving itself. If for no other reason, you have a laggard industry in terms of technology adoption in healthcare. You have a laggard industry in terms of technology adoption in higher education. So the opportunity for exponential gains is just massive.
So I know that earlier you said that you were the pushback, and then you spoke to people in healthcare and institutions that told you that that's the future. But now that you're on the other side and you got pushed into it, and are happy doing it, have you been getting pushback from any of those healthcare systems or other healthcare systems in having them adopt technology?
Oh, there's no doubt, right? There's no. It's no, it's in many respects good to be on the other side of the table. I have a lot more empathy for the emerging technology companies that I used to basically be the one to say no to, right? But I think that's prepared me really, really well to understand how healthcare works and really what's the criteria you need to meet in order to even have a chance. So the criteria I often talk about is you need to help your provider or organization make money, right? They have to generate revenue. You also simultaneously have to help them save money, right? So there has to be productivity gains. You also have to have impact on clinical outcomes, right? So enable them to deliver better quality care. Oh, and by the way, you have to make the clinicians' lives better, right? You have to improve quality of life for the clinicians and the caregivers. If you can accomplish all four of those things, okay, all four, then you have a shot, then you have a chance. And I think that that's what's really exciting about this technology, is that it has an opportunity. It's not a given, but we're already seeing what those, it used to be the small number of early adopters, I think largely accelerated by the current climate. We're seeing the number of early adopters scrambling to kind of come on board. I would say in the weeks immediately following, for instance, New York's lockdown, we saw a sales cycle accelerate, which is, I think, really telling, from 18 months or 12 to 18 months on average, which is not atypical in healthcare, just to start a project with someone, to 1 month. Now, I'm not going to get used to those numbers because I don't think they're going to stick, but I think it was very quick that people were realizing before this, if it's not broke, don't fix it. And then it got really broken really fast, right? And so people were looking for real solutions. So I think that we're going to see a more steady trend line. It kind of, it was kind of going like this and then it just spiked. I think we're going to come down a little bit. And I forget the exact quote. I love it. It's Warren Buffett. What's not to love about Warren Buffett? But he says something to the effect of, right, it's not until the tide goes back out that you see, who's wearing their pants. So, so I think we're going to see the companies that were really designed for enterprise really have the staying power and the capability to take their clients, add that measurable value for them, and really they're going to be the ones who are paving the path forward on this technology.
And you think that's what's going to create the staying power, and then and you also see that helping the technology get adopted across the board?
It depends. I don't know. Emerging tech, Silicon Valley style technology has always had this difficult time with healthcare in general. So I would say one of the biggest things that's happened in the past few years that kind of gave a signal that maybe things are changing and maybe healthcare and this sort of emerging tech world can do a better job of working together was essentially when Amazon launched their partnership with Berkshire Hathaway and JP Morgan. Only because Amazon is such a behemoth, they're such a massive player that they issue a press release and the whole market moves, right? So it couldn't be ignored. That was a really big change in the market. But before that, the healthcare industry used to kind of be like, oh, Google's coming into healthcare, great, we'll see how long that lasts. Oh, Microsoft's coming in, we'll see how long that lasts. I don't think that's the case anymore. And I think that there's a number of trends that have basically moved over the hump. And at the end of the day, the need is so great in healthcare to deliver better quality at a lower cost. They can't do it. They can't do it without technology. It's not possible.
Also, I mean, you mentioned about the 18 to 24 month runway moving to 1 month. Like, how do you scale up and meet all the demand in a situation like that?
Yeah, it's a great problem to have. Nonetheless,
Yeah.
Problem, right? So I think I'll give a lot of credit actually here to our parent company, the Glimpse Group. I don't think we would have been able to do it without them. Truthfully, we are part of an ecosystem in the Glimpse Group that's really enabled us to much more quickly accelerate our understanding of emerging technology. Technology like this, it's not just a function of having enough developers or enough developers with the institutional knowledge and expertise. The large players in this space, the hardware manufacturers, right? Even Facebook, they're having challenges, right? So we're not a hardware company. We're relying on the hardware companies to get it right. And if they don't get it right, it puts us in a bad situation. So being part of the Glimpse Group really accelerated our knowledge. It really helped us understand where the pitfalls are, where they aren't. And so at a very early rate, once we started going, almost 2 years ago, we were just head and shoulders, I think, better prepared than the rest. And I don't believe we would have been able to do that without the Glimpse Group.
And is that, I mean, I know the Glimpse Group has, different teams working, different subsidiaries working on different focuses. Do you think that some of that outside experience and knowledge, helps with that as well?
Yeah, I mean, technology is iterative, right? We often like to think of it like we have a hard time remembering way back when things were really buggy, right? Our CEO, Liron Bentovim, he often will say, we still even get Microsoft Word updates on a regular basis, right? Like their product is not perfect. No product is perfect. So one of the things that I think an ecosystem like the Glimpse Group enables is we can learn from each other's successes and each other's failures, right? Where things break down, we share that knowledge internally, whether that technology was originally developed for healthcare, education, retail, it doesn't really matter. At the end of the day, having that expertise in understanding an emerging, new, seemingly nascent technology, it's everything. I mean, there's almost no better competitive advantage in terms of the technology itself.
What do you think about, about like wearables and, the capturing of, tons of healthcare data in that way, just generally?
We should be thinking about, yes, we should be thinking about that information, but it's still, even right, I've got an Apple Watch. I know that I have now, because I have an Apple Watch and an Apple product, clearly I'm a loyal consumer, right? But I know that today I now have an electronic medical record with Apple, right? They're keeping a record of my health status, my health history, et cetera. It's still not mainstream yet, though, right? The data in there, with a few relative exceptions in the large provider market, right? Hospitals, health systems, outpatient, all of these things. Very few of them are actually looking at that data as part of my official record with them. In fact, I'm in Nashville. If I go to Vanderbilt Medical Center, in January, and then in February, I have a reason to go to one of HCA's hospital systems, they're not even talking to each other. So we're still a ways out in terms of having the ability to leverage things like wearables to really inform decision making, because that's what it all boils down to, right? There's a few really cool companies, I think, that are coming onto the scene now, only now, that are making this data actionable, right? They're turning that data into actionable information that can inform, okay, I should prescribe this drug over this drug, or I should discharge this patient to this facility as opposed to that facility. This is, making that data usable. It's a very new thing. I think that these consumer electronic companies, they're probably going to do a better job of putting the power of that in the consumer's hands, simply because that's what they do so well. Whereas healthcare, not historically known for really providing an incredible patient or user experience. Things are changing, but we're probably going to start to see much more integration of these things over time, simply because, like I said, the need is so great. These health systems are really, really, really struggling, especially in the current climate. No one saw this coming, right? With maybe Bill Gates. Bill Gates saw this coming.
He said it in November. He said it.
Yeah. He saw this coming, and he was one of the few people who was making that real urgent call to action to say, we cannot be sitting on our hands about this. But we look to our elected officials, we look to our healthcare leaders, we look to our community of caregivers. Where it's not to blame them, it's just to say, no one really thought this was a high enough probability we should prepare for. And our health systems, which were under stress before, are going to have to completely reinvent themselves. And some are taking positive initiative to do that. You asked about wearables, right? Wearables are just a piece of the puzzle. But it's really about using that data that we get from wearables to actually enable the next iteration of what healthcare looks like.
And if that data is integrated, do you think the pros outweigh the cons as far as sharing that data, so that you can have this whole of person picture? And again, like if you have, as an example, if you have, certain, car companies, the newer models, like they'll give you a call or email you that like you need an oil change before you even know, or get an alert in the car. Do you see that happening, and is that worth it? Do the pros outweigh the cons?
I think everyone has to answer that for themselves, right? And I think there's a lot to unpackage there, right? So yeah. The biggest is data privacy, information privacy, protected health information, and we cannot ignore that. I think that the reality, however, is that every time we make a choice to keep things separate and segregated, whether it be information or even people, there's a cost to that. And we're starting to see those costs balloon, really, quite frankly. And I think there's an opportunity to do a lot more by being able to share that data more freely. We're also seeing the emergence of new technology in terms of allowing us to see that data, but have it be non-identifiable data, right? So blind that data and use it. And that, I think, is one of the more interesting things happening in the health tech sector today, because it kind of squares that circle a little bit, and it allows you to make more meaningful decisions without crossing that threshold of protected health information.
That's awesome to hear, and you can infer plenty of data out of that, and see trends within the healthcare system without infringing upon people's data, which I think is fantastic. Yeah. Now you mentioned that you're in Nashville, because I always ask folks at the beginning, which I forgot to do, where they are. So since you're in Nashville, and in preparation for this, I was reading about, everyone knows it as a music town. You got those two beautiful guitars behind you. But tell us why it's also a healthcare town and now a tech town
Yeah,
in healthcare. Yeah.
increasingly a tech town. Yeah, I mean, yes, Nashville is known to be music city, and we have incredible music. I would say even more than incredible music. Really, it's a songwriter city. It's a city for songwriters, which is a really incredible thing, and something I didn't appreciate until I actually moved here. At the same time, right, music as an industry, at least, is dwarfed by the reality of healthcare being the absolute far and away dominant industry here in town. Healthcare, Nashville and Tennessee as a whole has an interesting history in that, Tennessee gave a lot of tax incentives to early healthcare companies and conglomerates, excuse me. And that attracted some of the largest healthcare companies to either set up shop here or move here a long time ago. And one of those is Hospital Corporation of America, one of the largest hospital companies in the world. And so when they came here, they attracted a lot of businesses who wanted to do commerce with them, right? To sell into those organizations, to add value to those organizations. And over time, those organizations grew and grew and grew. And so we in Nashville have really become a hub for some of the largest hospital companies in particular, healthcare services. We talk about it as healthcare services. So hospital and healthcare, some Medicare Advantage health insurance plans have set up shop here. And then now I would say, to your point, increasingly tech has started to set up shop here, largely because why wouldn't they? They have an opportunity to add a lot of value within these establishments. So I believe the last figures I've seen were that, Nashville, the broader Nashville area does something like $70 billion a year in healthcare, which, music just pales in comparison. So I think that's only going to grow. And I think the side to recognize that is that it's not all healthcare is here, but it really is health and healthcare services, right? So often people will look at Boston or New Jersey for life sciences. So I think they look to Nashville as the service side of things.
And that's it sounds like a good investment that Tennessee made, and it really stimulated. You've been there for 11 years, you said earlier?
Just under 10.
So just under 10, I apologize. Have you seen it? Has it grown tremendously, since you've been there as well?
Oh yeah, it's a different place. And in fact, when we moved here, prior to living here, we thought we would never leave where we were living at the time. We were living in Boulder, Colorado. And to us, Colorado was, and quite frankly, still is paradise. It's just an incredible place. And we never thought we'd leave. And we never in a million years thought we would leave to move to Nashville of all places. So our friends in Colorado were saying at the time, like, why would you ever do something like this? And for me, the answer was really simple. You could very clearly see that Nashville was on the rise. Again, going back to timing. It's all about timing. And so we came in, initial growth had already started, but nothing like we've seen in the last 10 years in all facets of life. And so Nashville has come to life in ways that most people never living here at the time never would have even imagined. It has its upside and its downside, right? Upside, greater diversity in the city, lots of new restaurants, new culture, a lot of that great stuff. Downside, traffic. so right now with social distancing, I'm not complaining. No real traffic to speak of. But I will say it's really been a phenomenal ride, and Nashville's been really good to us. So we have no reason to leave.
So what have you been doing in your lovely city of Nashville to stay calm, positive throughout the pandemic?
It's all about exercise, my friend. That is the solution to everything, right? This is not an easy time for anyone. People have it far worse than we do, right? So I think our biggest challenge right now, because we're all healthy, is on a personal level, is the balancing act of running a company, having 2 young kids, an 8-year-old and a 6-year-old. My wife also is a very accomplished professional, and we've got a very loud hound dog that needs a lot of attention and love. So trying to balance those things in ways we never had to before. I think a lot of people are feeling the stress and the burnout from that, making it a lot harder to resist going out in public and a lot harder to resist, doing things that made us happy. I would say the number one thing that makes this doable is exercise, right? It's just on a regular basis, keep you fit, keep you feeling good, burn some of that stress off, and just keep going.
And and have you learned any? I know you probably can't answer this because you've been busy and had the month-long deadlines, but have you learned any new skills or any hobbies during the pandemic?
A few new songs on the guitar, but I still sound terrible. But that's okay. That's okay because no one's listening to me except for myself.
And the hound dog. And the hound, yeah. What do you miss most from normal life?
Ooh, I gotta say travel. I'm accustomed to being on the road all the time. I often joke like I don't have an office, even though I've got one in New York and I've got one in Nashville. I've always used to basically live out of an airplane. I was always on the go. And so I think that's been an adjustment, not just for me, but also for my family, right? They're kind of ready for me to hit the road again. But I definitely miss the travel, right? I miss that process of being in front of clients, being with clients, listening to their challenges, understanding what they're dealing with on a very real personal basis, right? Building those relationships in person. Simply put, it can't be done virtually the same way. So you got to adapt.
And that's coming from a technology person too, right? No, I agree. There's nothing.
I'm a believer in the personal touch. It's another reason why I love healthcare. We don't talk about ourselves as being a VR company. We talk about ourselves as being a healthcare company. And healthcare, I always stress to people, they need to simplify their understanding of what it is. It's really just two individuals, right? It's a caregiver helping a patient. That's all it is. And those are roles, right? Those often reverse, right? When our caregivers are ill, we need to care for them as well. So it's a service at the end of the day. And I love that about healthcare, that it really boils down to people helping other people in their most vulnerable situations.
What's your currently, before we wrap up, what two last questions? What's your current day, what impresses you most, like a piece of healthcare technology?
That's interesting. Yeah, I don't know. I don't know if I have a favorite, truly. I think, yeah, I definitely don't. I can't play favorites. You mentioned something earlier, which I think is revolutionary, but it's on a long-term trajectory, and that's wearables, right? I think that's really going to change things, not just from a data standpoint, but really enabling us to take stock and ownership in our own health. Between you and I entered a calorie burning competition with my wife. I won, which is a huge surprise. And just those types of gamification aspects, right? Those things, I think they're going to engage us in our own self-care in ways we never had been before, which we have to do more and more of.
So you're going to challenge me to give blood next week? Okay, fine, I'll do it. No.
I won't do that in this climate.
Yeah, exactly. You kind of answered my second question, but it was what. But I'll still ask, a little differently. Within AR and VR, what's the next use case, like, or the most important need as far as filling a void with technology in the health space?
Yeah, I think I said it before, and I'll say it again, to quote a great line in one of my favorite movies, Ferris Bueller's Day Off. I think this is a technology that's very clearly, it's uniquely suited for knowledge acquisition in a way that no other technology really can provide. It's tapping into our natural tendencies and behaviors to learn by doing something, right? That's one of the most exciting ways, and one of the most effective ways, is to actually go through the process, make mistakes, refine, iterate, do it better every single time. I think when you have technology that focuses on the human condition and it enhances it, it's a win.
All right, we'll leave it with that. Where can we find Immersive Health Group and the Glimpse Group online?
Yeah, Immersive Health Group is just that, immersivehealthgroup.com, and Glimpse Group is glimpsegroup.com. So yeah, always happy to chat about healthcare, about technology, and how we can make a really big difference in a changing landscape.
All right, Dev, I really appreciate you joining me. Good luck on the guitar, and thank you so much for taking the time to speak with us today.
I'm gonna need it. Thank you, Warren.
Thank you. Cheers, man.